see patients whose blood tests are technically normal, but slowly drifting in the wrong direction. And that slow drift is where many long-term conditions begin. I've had patients say to me, but doctor, last year everything was normal. And we compare the results over the previous 5 years, and we see the HbA1c slowly rising, cholesterol pattern shifting, kidney function slowly declining, liver enzymes creeping up, although still inside the lab range, but not stable. Hi, I'm Dr. Ali. I work in family medicine or general practice, and today I want to explain why normal blood tests don't always mean you're metabolically healthy and what doctors are actually looking for behind the scenes. Because prevention does not start when numbers turn red, it starts when they start drifting. Let's start with something simple. What does normal actually mean? When a lab prints a normal range, it usually reflects where 95% of the population would usually fall. But here's the issue. The population includes people who are overweight, people who are insulin resistant, people with early disease, people who don't exercise, people who sleep poorly. So normal does not mean ideal. It means common, and common today includes a lot of metabolic dysfunction. For example, if 40% of adults are pre-diabetic or insulin resistant, that shifts the average. So being average may not mean healthy. That's the first false sense of security. If your HbA1c is 40 today or 6 in American units, which is technically normal, that's one thing. But if it was 34 3 years ago, then rose to 37 2 years ago, then 39 last year, and became 40 today, that tells a story. The body rarely changes suddenly. It shifts gradually. The same with cholesterol, same with triglycerides, same with kidney function. I often open up a patient's record and scroll back 5 years. That timeline is more important than a single result. Prevention lives in trends, not a single snapshot. Let's talk about HbA1c. This measures your average blood sugar over 2 to 3 months. Pre-diabetes usually starts at 42 or 6 in American units. But here's what many people don't realize. Insulin resistance often starts years before HbA1c rises. The pancreas compensates. It produces more insulin, so glucose stays normal for now. But insulin levels are higher. That higher insulin affects your fat storage, your blood pressure, your fat in the liver, and of course, inflammation. By the time HbA1c crosses into prediabetes, the underlying process has often been developing for years. So a normal HbA1c of 40 that used to be 34 is not reassuring anymore. It's early metabolic drift. And that's where lifestyle changes have the biggest impact. Most people focus on total cholesterol, but that's not what I look at first. I look at patterns. For example, rising triglycerides, falling HDL, which is the good cholesterol, LDL is creeping up. Even if LDL isn't high, the triglyceride to HDL ratio tells us about insulin resistance. I've seen patients with normal total cholesterol, but worsening triglycerides over years. That pattern often comes before diabetes, and it often comes before fatty liver. Numbers can look fine in isolation, but together they form a picture. ALT is a liver enzyme. If it's extremely high, we investigate urgently. But what I often see is something more subtle. ALT rising slowly within the normal range from 18 to 22 up to 27 and finally to 32. Still normal, but trending upwards. That often reflects early fatty liver, and fatty liver is strongly linked to insulin resistance. Again, early phase, again, reversible, but only if recognized. Kidney function, measured by eGFR, naturally declines slightly with age, but gradual decline over a few years, even within range, can signal early strain. For example, if your EGFR goes from 95 to 88 to 82 to 78, that is still above the cutoff, still normal, but drifting. Kidneys don't fail suddenly. They lose filtering capacity slowly. Early recognition allows for better blood pressure control, medication adjustments, and metabolic optimization. This is where long-term outcomes are shaped. Let's move to CRP, which is a marker of inflammation. If it's very high, we look for infection, but mild, persistent elevation, even within range, can reflect chronic low-grade inflammation. Chronic inflammation contributes to arterial stiffness, insulin resistance, plaque formation. It's not dramatic, it's quiet, but over years it matters. Blood pressure of 128 over 84 may be labeled normal, but if it used to be 110 over 70, let's say 5 years ago, that's a shift. Blood pressure creeping upwards is often part of the same metabolic pattern. It rarely happens alone. When I see rising HbA1c, rising triglycerides, and rising blood pressure together, that's not a coincidence. That's metabolic strain. Here's what concerns me more than a single abnormal result. HbA1c drifting upwards, your waist slowly expanding, HDL levels falling, triglycerides rising, ALT creeping up, blood pressure increasing. Each number alone may look harmless. Together, they tell a story. And that story usually begins 5 to 10 years before the diagnosis of type 2 diabetes, hypertension, fatty liver, or even cardiovascular disease. That's the false safe zone. This is not about fear, it's about leverage. During the normal but drifting phase, muscle building improves insulin sensitivity, sleep improves hormonal balance, reducing ultra processed foods lowers the insulin spikes, spacing your meals reduces the constant insulin exposure, stress reduction will lower your cortisol levels. Small changes at this stage produce larger long term effects. Remember, after diagnosis, we manage disease. Before diagnosis, we change direction. If your blood tests are normal, that's good. But don't stop there. Ask, is it stable? Is it drifting? What does the trend look like? In general practice, prevention is about spotting patterns early, not waiting for numbers to turn red. Because the most powerful window is the one before diagnosis. If you found this helpful, do subscribe. I make simple, evidence based videos about early detection and long term health from the perspective of a resident family medicine doctor who sees the early phase every single day.